Hello, hi, my name is Dr. Kevin Yip. I work at Singapore Sports and Orthopaedic Clinic in Gleneagles Medical Centre. I'm an orthopaedic surgeon and I look after people with knee and shoulder problems. Well, when I was young, I used to like to fix things, home appliances and so on. And I also do a lot of building bookshelves and bookcases and so on. So I suppose when I was young, I always wanted to fix things. So orthopedic is a little bit like that, make things better. I think nowadays with the modern age of technology, I think the blogging is certainly a very useful communication medium. And the reason is because a lot of people wants to know how to various tips how to improve themselves and how to deal with various problems. So we do give a lot of guidance in the internet, and that's giving out information freely to the patients. But at the same time, the patient often will ask, these are the problems that they often encountered. So it's almost like a two-way communication with a lot of people, and that you generally get the feel of what kind of things that the people want to know and what are the common problems that's frequently encountered. Stretching of the joint is very important. So usually after the operations, we encourage patients to do linear pendular exercise of for the shoulder. So this will be the linear pendular exercise. We also encourage them to do a circular pendular exercise, which is swing arms like this. So with this, our shoulders are moving at about 45 degrees flexion all the way around like this. Now after about 2 weeks, when they become more and more comfortable, then one can actually do some exercise with an umbrella. Now how we do this would be to here we have an umbrella, but any sticks or golf clubs will do. But the aim is to relax the muscles as much as possible, and using the other hand in order to assist with the movement. So, and the umbrella or the pole is there to transfer the force to the other hand. So here I move my shoulder upwards like this. This will be a full flexion. Here you see that I'm using the other hand to push my right shoulder upwards as much as possible and maintain to be there for about 20 seconds, and then I gradually control the descent, and then I move the shoulder to another position. This we call it the abduction position. And then after that, again doing the same thing, hold it there for about 20 seconds, and then gradual control descent. And we'll do the same thing with extension as well as external rotation. So these are the exercises that one can do in order to stretch our shoulders. Well, we do see a lot of patients with sports injuries. This is a sports clinic, and that we see a whole range of patients. Some are very young, weekend warriors. Others are slightly in the middle-age group, where they want to continue to do sports, and sometimes they do injure themselves. We see shoulders and knee problems. In the case of the knees, we see a lot of meniscus problem, ligaments problems like the ACL, anterior cruciate ligaments, and cartilage as well. In the case of the shoulders, we do see patients with torn tendon as well as capsular stiffness. So we see mainly those two areas, but we do see other things like ankles and spine as well.